Good afternoon, everyone, and thank you for joining us for part 3 of the Future of Women of Color series by A Maven's World. My name is Anna Foster, and I am the founder and CEO of A Maven's World. Today's session is Advancing Health Equity for Women of Color. Why is this discussion important? Well, health systems are failing women with the pandemic, only widening the gaps, particularly in women of color. Health disparities are particular to differences that are closely linked with the social, economic, and/or environmental disadvantage. In order to tackle health disparities and inequities, women of color have to become more aware about health disparities and inequities, demand adequate health care, and learn to better advocate for themselves and their family. Social conditions create the environment for health disparities to exist and persist. They are the social determinants of health, the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life, outcome, and risk. Data tells us that unfortunately, the color of your skin can affect the quality of your diagnosis. It also tells us that Black women are more likely than white women to be diagnosed at the stages of cancer and to die, even though breast cancer is often considered treatable when detected early. Black people are also more likely to die from complications of diabetes, and the list goes on of disparities and inequity in healthcare due to the healthcare professionals' cognitive biases, along with decades of clinical studies that examined only white male bodies and a lack of understanding about the social determinants of biological illnesses. Health barriers and lack of resources led to unmet healthcare needs and the inability to secure preventative services. So we want you to pay attention. Health equity acknowledges that everyone does not start from the same place. It is a fact that racism, sexism, ableism in the healthcare system, has direct implications for health access, care, and outcomes. Strong leadership and advocacy are critical to closing the gap in health disparities and for advancing health equity for women of color. Today, you will hear from our panel of experts on this important subject matter. It is my hope that you gain knowledge and resources through this discussion and that you utilize your power going forward, and it prepares you to better advocate for equitable health care for yourself, your family, and your community. So please welcome our moderator, Pilar Tucker, who will be joined by panelists Doricella Green, Melody Noreen Blackwell, and Kelly Kilo. Please use the comment or chat section for questions and your comments. Also, please share this video to enlighten others about the importance of health equity. Thank you.
Thank you so much, Anna, for this phenomenal event. It is so important that we come together and honor and educate, elevate each other on advancing health equity for women of color. As we join in part 3 of the Future of Women Color Conference series, Advancing Health Equity for Women of Color, I want to point out the significance of health equity. As the CDC states, health equity is achieved when every person has an opportunity to attain his or her full potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Health inequities are reflected in differences in length of life, quality of life, rates of disease, disability, and death, severity of disease, and access to treatment. Although we have this definition, The disparities, poor outcomes, and higher death rates for nearly every medical condition the panel examined, and the structural racism underlying them has remained. The grim truth has been made startlingly clear by both the pandemic and by statistics that show Black Americans continue to die up to 5 years earlier than those who are white. The CDC also says that there's an estimation that in 2019, there were some 70,000 Black Americans, nearly 200 per day, died prematurely, many from chronic conditions like heart diseases that could have been better treated. With that said, health equity is not an option. It is a priority. And to advance health equity, I'm going to bring in some of our phenomenal panelists today who will help drive this point home. So welcome to Dorcella Green, founding president of Beyond Patient Health Equity and the Healthy Equity Community Engagement and Partnership. Melody Blackwell, founder of Color of Crohn's and Chronic Illnesses, Inc. And last but not least, Ms. Kelly Kilo, CEO of A Healthy Crush LLC and co-founder of Alkaline Electric Society. Welcome, ladies.
Thank you so much for having me.
Thank you.
Thank you for having us.
Absolutely. And again, I am Pilar Tucker. I'm the founder and CEO of Radical Transformation, and I'm honored to be here today as your moderator to really facilitate rich dialogue on such a vital topic. So for the first question, let's get into this. The first question I have, and this will be for Dora and Melody, why does health equity matter to you? And why is the work that you're doing in this space so important? Let's start with Dora.
Thank you, Pilar, for that question. So health equity, when I think of it, it's important to me. And actually, before I begin, I just want to introduce myself to those that might be using assistive devices. I have rich dark brown skin. I have locks down to my shoulder, and I'm wearing a blouse that is green with floral print, I guess, and gold earrings. And so when I think of health equity and why it's important to me at Beyond Patient Health Equity and why we started this nonprofit organization, it's really related to the multiple layers of my identity. I am Ugandan and Tanzanian. I am first generation born in America. I'm a mother to African American children and a wife to African American men. And the list can go on, in terms of what I identify with or see myself as. But throughout my life and my career, I've experienced and witnessed many injustices. And today, as I sit with you all as a pregnant woman and sharing with you where I am in my journey, second time around, I'm truly tired of reading of how our maternal health and mortality rate for specifically African American women continues to rise without intentional actions and deliberate outcomes in terms of advancing health equity for women of color.
Thank you so much, Dora, for that and bringing your voice and your space and your identity, your beautiful identity and your family into this, because it sounds like it's important for many reasons. And you're tired of the injustices that continue to perpetuate and plague our communities as Black women and Black families. Melody, I want to pass this along to you. What are your thoughts?
Absolutely. Thank you. I'm going to take a page out of Dora's book. I'm going to try this. I've never described myself, so this is going to be interesting. I am latte complected. Does that sound right, guys? Does that work? Okay. Latte complected. I have two flat twists, one on the left, one on the right, going to the back of my hair. I have on glasses that are squared off at the top, but rounded at the bottom. I'm wearing rose-colored earrings, gold balls, and I am wearing a floral dress that has hues of gold, purple, and tan. Yeah. Okay, that was cool. I've never done that before. So, and when it comes to health equity, what that means to my community and why it's important It means access to diagnosis. It means actually understanding that a stomach ache leads more, that there's something more complicated than changing your diet, than what you're eating, environmental complications, stress levels. It means understanding that there is a holistic approach within your body and outside of your body to understand and get access to proper care. If you are Black and brown with IBD, inflammatory bowel disease, digestive diseases, you have a higher level of death or serious morbidity because you're not recognized in the space, nor do you know, especially as Dora explained her cultural makeup. My father is Indian and my mom is Black. So there are two cultures that are not readily knowledgeable about digestive diseases and digestive as a whole, yet they eat very savory foods, heavily seasoned foods. Food is a synergy. And having a digestive disease personally, I know that that was usually thought to be the cause of why things might have been going on with my body. Having suffered since I was 6 years old with digestive complications, not being diagnosed until 36, definitely was a huge impediment on how I lived my life. I didn't choose to be strong. I had no other option. I didn't know to say, I have a disease and this is what's going on with me. When I was dragging my foot, when I was unable to focus visually because of chronic eye infections, I didn't know that it was all a cause from an inflammatory disease. Because when we think of IBD, digestive diseases, Crohn's or ulcerative colitis, we only think you use the bathroom too much or you don't use it enough, not realizing that the inflammatory component can exacerbate any part of your body. Inflammation I've had it in my joints, I've had it in my mouth, I've had it in my feet, I've had it in my elbows, preventing me from moving in certain realms. And then it creates an impact of isolation when you think, which was told to me, that you are the only Black person or brown person with the disease, that you were the first Black or brown person with the disease. You have no space for community. And we know that culturally, community is a synergy. It's a hub for wellness and healing for us. Pilar, you're on mute.
Absolutely. Thank you so much, Melody. And thank you for bringing that to the forefront, because many times when we think about access to diagnoses, we completely miss the psychoeducation of it. We completely miss the language of it. Sometimes we even bypass because we don't understand the language of it and its severity. But like you were saying and sharing your own personal experience, mental illness and physical illness go hand in hand. And we as a community have to understand how some of these environmental factors and these internal factors are impacting and perpetuating physical and mental illness. So I appreciate you bringing that.
One level deeper than that, Pilar, is because we're not educated in our family spaces about these diseases, the complications and using the bathroom 25 to 30 times a day and the not being able to work because you can't go to your job, your family starts to think, oh my goodness, they're being lazy. This isn't real. This can't be possible, because we don't have any breadth of understanding what the complications are with these particular diseases.
Thank you for that. The education is key to knowing what is going on, so we don't mislabel or misdiagnose with laziness or with falsities. Like, we want to make sure that we are addressing the appropriate cause so we can get it treated appropriately. So thank you both for that. Now I want to ask you, Kelly, what does your organization do to reduce health disparities and move forward towards greater equity and health?
Sure, absolutely. Some of our stories are kind of similar, which is fantastic. So I'm the co-owner and CEO of a Healthy Crush LLC. We're a healthy lifestyle brand that focuses on toxin relief and improving mineral deficiencies. The ingredients for all of our products follow the recommendations of Dr. Sebi's African Biomineral Balance, which many people are familiar with. And it's something that I used in order to clear leaky gut, fibroids. I had severe inflammation and calcified mucus throughout my body. And I recognized, honestly, I first went to sort of a vegan lifestyle, but a lot of the ingredients in a lot of these vegan foods are just, ripe for inflammation problems. And that's where I think I, incurred leaky gut. So what our best practices are is we help to educate our clients on best practices for maintaining a balanced body. You can use alkaline herbs, and you can also, address food problems, which Dr. Sebi has a nutritional guide, but I even take that a step further and suggest that you get a sensitivity test, because there are so many foods and just things that are in foods that will cause so many complications to the body, which hurts my heart because I see so many people that try desperately in order to maintain a healthy lifestyle, and they're just putting things in the body that are causing toxin overload and creating imbalance in the body. So we just focus on best practices because, look, a doctor's opinion is just that. It's an opinion. And a lot of us just don't understand how our own bodies work. Simple things like drinking the proper amount of water every day, and going to sleep on time, and dealing with anxiety issues, doing consistent moderate exercise, not just for weight loss, but to improve the circulation and digestion in the body. We're just sort of taking a step back into like 101, because I hear a lot about self-care, which, it's like get a facial or take some time off, but self-care should also include making sure that you know how your body operates, and when there is a problem, to create a solution with your doctor or someone who's your healthcare professional, that really sort of makes sense for you, and it isn't just somebody just telling you what to do. And I think that helps with health disparity and inequities, because you can have that conversation with your doctor as opposed to just them telling you this is what it is, and a lot of times them being incorrect.
Absolutely. And thank you for sharing that and the work that you do with your organization. The best practices to educate clients to have a healthy body, to have a better relationship with their body, and really understand what certain foods do to create some of these illnesses is absolutely a amazing way to reduce these health disparities, because a lot of our people die of lack of knowledge, and so having that knowledge is power. And so to educate them on what is going on and how that relates to our, like you were saying, sleep, our digestive system, anxiety, stress levels, food plays a vital role into our full well-being. And I'm
sorry. Often you're enacting disease by what you're putting into your body, or even, on your body. Our company actually does a sensitivity guide. Most times, you see companies, they'll do like the 300, 300 foods. We do 800, as well as, looking at the gut biome, looking at, your mineral deficiencies, because those are the building blocks in order for your body to self-heal. You can heal a cut and you can heal a bone, but yet when you tell people that you do have some control over what's happening over you, they don't get that. So, what our dialogue is trying to help people gain some control and onus over their body, so they're just not being told what to do, but they're actually included in the dialogue.
Awesome. Thank you for that. Being included in the dialogue to help your body heal. So that's perfect. That's a great segue into our next question, which, Dora, I'm going to ask you, what are some of the chief obstacles to doing more, and how are you navigating these obstacles in health equity?
Thank you for that question. And I want to pull from what Kelly mentioned, putting the onus or allowing us to have that autonomy back, right? As individuals in the community, or specifically people who identify within the BIPOC community, we feel like we don't have that power anymore in the provider's office to ask questions, to push back. And I think some of the things when we're thinking about obstacles, when you're looking at a bird's eye view of the obstacles, specifically in Boston, where I'm at, you have to think of all the social determinants of health. And what I'm seeing right now is the housing crisis in Boston, and how that is so key. It's impactful, and it is like if you're thinking of the recipe for positive health outcomes, you need to have a home, right? That is like a basics. And right now, the housing crisis within Boston is just miserable. I know that there's a lot of work being done behind the scenes, but we consistently have high rises coming up in multiple communities, gentrification, and it is not with the thought of these people who are unhoused, who are experiencing that. And, when you look at the data, just a few years ago, we have a population of over 500 people who have been and consistently remain unhoused. And that's not to mention the other comorbidities that they're experiencing, or other illnesses that they may have, whether it be substance use disorder, whether it be hepatitis C or B. Some of these treatments for patients, specifically with hepatitis, are ones that you need to have a home so that you're able to utilize the restroom after your treatment. And people won't take that. And that leads to high utilization of the emergency room, and not utilization of their primary care provider. And so there's so many levels of where we can really have impact, move from these conversations to practice of healthcare by having conversations, being participants within these local town halls, being that, squeaky wheel, like, hey, what are we going to do about the people in our environment or in our area that are experiencing homelessness? How are we going to support them? Because when we're thinking about advancing health equity, we can't think just of ourselves. Martin Luther King, and I'm probably like annoying with this because I say this in every panel discussion. He says, a threat to justice anywhere is a threat to justice everywhere, right? So when we're able to improve the quality of life, when we're able to address the systemic and structural barriers for those that are experiencing the greatest inequities, which is the African-American community, but then also extending beyond that, there's going to be great impact and benefit to the rest of the community where we can advance health equity for all. So long-winded response, but
Long-winded, but right on time and powerful. And the points that you hit are imperative for us to hear, because I think many times we bypass the challenges that are right in front of our doorstep. Environment plays a major role in how we are even accessing health care, how we're even going to the doctors, what the community in which we live in. Homelessness impacts the way that we're taking care of ourselves, what we're eating, what we're seeing, what we're drinking on a daily basis. And so you were saying about the housing crises and people needing to have a home, because homes lead to positive health outcomes. When you have a home, you have, you're under the assumption that you have a fridge, you have some food to put on your table. But if you don't have any of that, then how are you getting the proper and adequate health treatment? So I appreciate that the suggestions and the points that you brought up, Dora. Melody, I want to bring it to you. I have not forgotten about you. I know you ready, and I'm ready to hear you.
I'm like,
too.
yes, Dora, yes. Everything you're saying, but your question was, what are some of the chief obstacles? There's just one chief obstacle. It's the whole structure, the whole structure of how everything is delivered, and then we have to go in and break it on down, right? So in my space, Dora's talking about hepatitis and homes and just basic functionality, humanity at its lowest space, to have a home and to have food to access. But we're dealing with communities that are living in food swamps and food deserts. So when this registered dietitian comes in and says, okay, now you have to eat almond flour and now you have to shift this over, it's tougher when you haven't even invited them to understand maybe diet is a challenge, and let's see how we bridge this together. And for obstacles, I think about really, what nucleus do we need to attack first? Or do we need to disrupt and restructure? What nucleus is that? In my space, it's industry, it's other organizations, it's the healthcare system and delivery, it's the community itself and their mindset, and combating medical mistrust and giving them tools and tips on how to have confident conversations, because they are afraid of that white coat. They are afraid of the inferiority, superiority complex that is presented to them when you have heard your doctor say over and over again, are you the doctor or am I? When grandma has said, don't do that. When grandfather has said, don't do this. When there's still remnants of Tuskegee in your home. You are met with these challenges and say, is it time for this generation to trust the system, or do we still manage it this way and we deteriorate because we have no opportunity to gain knowledge? I hear people say all the time, well, they could Google. If people really wanted this, they could Google. No, it's not they can Google because they don't know the lexicon. So they're still at a disadvantage because they haven't been invited to understand the language that they need to be equipped with to manage this. Another thing I hear people say often, which, I agree with in part, and then I disagree with, is we need more Black doctors. Yes, we do. 1000%, we need more Black doctors. The challenge with needing more Black doctors is that it won't happen fast enough. The delivery is still sometimes challenging because they don't always know about a particular space or disease, and they're trying to remedy and help. So we're putting more pressure on them. But also, there's so many other doctors that are not Black. We need doctors that care. Black, white, yellow, orange, pink, purple, whatever, 2-headed, 5-headed, doesn't matter. We need doctors that care and will be honest with us and say, I don't understand where you are in this disease. Let me phone Dr. Pilar. Let me talk to Dr. Dora. Give me some time to do some investigation, because that's how we have patient-centered care. That's how we have collaborative care. That's where shared decision-making is. We're talking about care plans. Our community members don't know what care plans are. When we ask them, what's your care plan? Oh, my doctor said to do this, this, and this. That's not a care plan. And it's certainly not patient-centered. So this is a multifactorial issue that we're having to step in to navigate, because healthcare doesn't present those opportunities for us.
I just want to chime in.
Absolutely.
Sorry.
Yeah.
I wanted to chime in on what Melody said. You're right. We need more providers of color, Black doctors. We need more match residencies, because we can't be having an influx of providers and then have nowhere to put them, right? Going through those 4 years and they have no space. We also need to change the structure of a medical school system, because right now we're working off of a system that doesn't exhibit or show diverse content, doesn't show the multiple skin colors that we have in spaces, or the presentations that, Melody, you mentioned earlier, in terms of how a disease might manifest in a different ethnicity or a multiracial ethnicity, right? And so we need to change that structure. And most importantly, we have to have the conversations about health equity. 2-hour courses or an experience is not enough, right? Being out in the field is not enough. Going to a place and providing medical care for a disaster relief, it's not enough, right? It's the same way how a moment of silence is not enough. We need to be more intentional and deliberate in creating those spaces, and medical schools need to be inviting people from the community. How do we collaborate? And it needs to be sustainable. It can't just be like, well, we're doing this for the benefit of educating our students. No, we need to have it extended. What does that relationship look like? How can we address social determinants of health and educate the next generation of medical practitioners? And it shouldn't just stop at doctors. It extends to the whole spectrum of healthcare providers, licensed or not. You should have that experience, and it should be welcomed, because again, it impacts us all, right? If we're able to address those things, we're able to address the cost in healthcare spending, which comes back to us in terms of taxes, right? And the organizations we work for. When people are like, my insurance is too much monthly to cover me, my family, and the rest of, hello, this is the things that we can do to impact that. And I think where we're having, again, and I go back to conversations to practice. We know this information, and truly, and I'm grateful for you ladies that you're in this space having these conversations and calling people to action in regards to that.
Absolutely.
I'm sorry.
One more.
Yeah,
Go
sure.
ahead.
to lend my voice to this because our nonprofit Alkaline Eclectic Society actually pays homage to eclectic medicine, which was a branch of American medicine in the 1800s. And this was the use of non-invasive therapies and healing practices, which had at the time 20,000 doctors. Now, I won't go into the whole, diatribe of why that system does not currently exist. But yes, I mean, we kind of have to peel back all of the layers so that we can really help to, make a difference when we are advocating for ourselves, to know what sort of makes sense and what doesn't. And it's a journey. I mean, this isn't something that you're going to kind of come to the table. It's not just, Google and, because honestly, a lot of the information no longer exists there. But it definitely is, occupying spaces and meeting with people who, can share their stories, even believing that, your body has the ability in some respects to heal itself, with the right, with the right elements and lack of. I'm a strong believer in fasting, for instance, to relieve toxin overload. And now when I say fasting, people always assume that I mean that would be totally restrictive, which I don't agree with. You need to not just detoxify the body, but also enrich it with minerals. So that means, fasting, not just with, juices, but perhaps soups, or if you wanted to do a mucusless food diet. These are things that you need to kind of come to the table with and, see if they actually work in order to make sense for your body. Because I'll tell you, it took me years in order to get over some of the issues that I got over. But the journey was incredible. It was an educational process. And I'm so happy to be able to have lived in that space, to be able to help other people sort of get over some of the issues that they have.
Thank you, ladies, for your power and your truth, because we need this space. We need the space to be able to share our own experiences, because even within our collective communities, we're going to have a different narrative on what it is and what's happening. And historically, we know that the health systems has not always been in our favor. And this has been perpetuated throughout history. And something that I really love that you all said, to kind of sum it up, it's like equality does not equate equity when we're talking about healthcare. Health equity is different than equality, because health equality, like Melody was saying, is having Black doctors. That's equality. Oh, it's fair, we're going to get more Black doctors. Whereas health equity is meeting the Black and brown clients where they are. We have to make sure that we are in our spaces and our health spaces, educating, elevating, and empowering our Black and brown clients to have a voice, to share their story, to collaborate with their providers in order to diagnose appropriately and not misdiagnose. We have to make sure that we're educating at the dinner table, at church, at all these different spaces that we're occupying. So then when we do go into our yearly or biannually pap smear check-ins, that we know exactly what to ask and why we're asking it. So I thank you all for that, for the power and the voice that you all brought to this question. Especially, I saw the fire. We have this space, so it's your time to definitely share. But this next question I'm going to ask to you, Miss Melody. What are the opportunities for your organization to impact health equity and health disparities through your organization's mission, vision, and values?
You said what opportunities? It's so easy because there's all the opportunities. Because before coaching, no one was doing it. Before color of Crohn's and chronic illness set foot in this space, Black and brown patients were heavily disadvantaged. So much so that we don't even have epidemiology information. We don't have the phenotype information. We are told consistently that Black and brown patients don't have these diseases to this day. I feel like that meme where they're like, to this day. That's how I feel exactly. To this day, we still don't have this. So we have been able to execute a lot of things on the ground. We know that like these Zoom meetings, webinars are such a huge opportunity, but there's so many community members that don't have access to internet, or they just don't look for health information. So they're not going to be inclined to watch this webinar unless someone actually puts it in front of them. So we know that awareness was like our first metric to decreasing disparity. You could have a disease. You should not have months and months and months on end of stomach aches. You should not have blood in your stool. You should not have cramping pains each time you eat. These were like little things that we knew that we could say to get them intrigued or trigger them to want to know more, outside of waving a woman with a string bikini around. So we used those tools that we had, and we started to go to HBCUs. We started to go to churches. We looked in other groups to find people that were looking for Black and Brown community. And before you know it, we were at over 600 community members. We're putting on the Equity and IBD Patient Symposium. We're getting stakeholders that are at the highest tier, and we're just 2 years old. But I am from the school of I will not ask you for permission, especially when you have not done it, because if you didn't decide to lead the way, then I will. And we've had to realize that a lot of our community members went underserved because they didn't know that the disease existed and they should be tested for it, or at least some of their symptoms should trigger deeper understanding for their physicians. That we started things like IBD Together Support Group, Meet the Medic, where we challenged inferiority and superiority in patient-provider conversations. With the patient symposium that I told you about, community conversations where we're talking about mental health, digestive diseases, and clinical research, our own research grants that we've issued 2 of them as a 2-year organization, because we have to understand this phenotype. What is the difference between Black patients and white patients? What is going on with us? Why is our disease so severely complicated? Me having 8 fistula, and then drains in my colon, losing my hair, having eye function, losing my mobility, 35 pounds in 6 weeks, that's not normal. And we have to ask ourselves, what is going on with me that I need to say, and who's not listening? Because if they're not listening, I can fire a doctor. I can fire this doctor because they no longer serve me. But our community, they're afraid. If this one doctor doesn't help me, or if I voice my opinion and they say, well, I can't see you anymore, what do I have left? Especially in smaller rural communities. Hey, you have Coachy. So if anybody's watching and that's happening, call me, because that is not okay. It's not acceptable. It's not allowed. And we don't play those kind of games over here. But that's what they've had to deal with in managing healthcare, because there's only one community provider that doesn't understand your disease, that will continue to give you something that's actually deteriorating. Like Kelly was talking about, I see a holistic physician and I see a healthcare, more worldly Western medicine practitioner. I see them both. And that is how I create a care plan for me, because I'm a part of this process. And if I'm not at the nucleus of this process, then it ain't for me.
Thank you, Melody. Creating a care plan for me. And if you aren't already following Coachy, make sure you do that right now, because we need more spaces and organizations in this space and in our communities that will educate, that will diversify the level of resources that we're receiving, and that can explain in our language what this means, why this is important, and what is happening. And sometimes you will get that in your westernized medical practices, and sometimes you won't, but that doesn't mean that you can't have the answers to what's going on with your body. And it doesn't mean that you can't have a care plan like Melody was saying.
Right. I will say that if there's anyone who's watching that has challenging time speaking to their care provider, please email us at info@cocci.org, and we can send you our Confident Conversations guide. It helps. It gives you information about your rights, questions to ask, and how to manage your appointments with your physician.
Thank you. And it's imperative, to understand the impact of this. And it's important that we treat our bodies like our temples. And so we're going to have to know what's going on in our bodies to be able to do so. The next question I have is for you, Dora, and Kelly. What are some of the current challenges of addressing these types of disparities that are plaguing our communities? Kelly?
Oh, did you? Oh, sure. Hi. Gosh, I feel like, healthy people feel like healthy is boring. So, it's sort of a drag. And so that's really difficult in order to help people, say, look, you want to take this out of your diet, sort of see if that's an issue, and that's problematic for them. But what we do, which is great, we've launched a couple of, mucus-free food detox books and alkaline eclectic books that really sort of hone in on, you don't have to change the menu, you just have to change the ingredients. So my husband, Chef Crush Foster, he can create, your best, barbecue and anything that you can possibly think of by using foods that actually have more resonance in the body. Additionally, we have been shadow banned, I don't know how many times. When you look at sort of the social media aspect of it, unfortunately, I had an account where they just deleted me on Instagram, 20,000 followers. So that is a challenge, really getting your message out. We have had classes in the past, and that's how we sort of addressed it. In our Brooklyn home, we had classes on our first floor for several years, just so that we could bring the community out, and so that you could kind of create sort of people that you can kind of talk with and share with, so that you don't feel like you're so alone in the process, because that's sort of the difficulty, right? I think Melody sort of spoke to this, that, you just kind of feel like you're out here on your own, and that, there's these issues with me. A lot of times, a lot of our issues, fall in line with fatigue and, people just thinking that, what is wrong with you? Oh, here you are again, because visually you may look fine. But, internally, you're dealing with so many dynamics that, can cause so many problems in your day, and really in your mood, because we're talking about mental health, right? And, to know that you're going through all of these issues and then no one, really sort of understands is really difficult in terms of even helping your body to self-heal, because you've got all this stress and anxiety associated with the illness.
I thank you for bringing that up. And I also, as a clinician and clinical psychologist in training, have to honor this is Mental Health Awareness Month. And mental health awareness goes hand in hand with our physical awareness and our physical health. We have to understand that the body, the mind, and our behaviors are all interconnected. They're not one, you don't put one off to the side, just like you wouldn't put off going to get help for a doctor, or going to get your nails done, or going to your job. We can't put off mental health, because people are dying by mental illnesses and physical illnesses combined at a rapid rate, and our people don't always have the language to say, I am hurting. And so instead of saying I'm hurting because I'm sad, we persist. Like you were saying, Kelly, about that externally we look fine, internally we are dying. And so in order to live and thrive, we have to be people who are accessing our health, making health sexy. It doesn't have to be boring, like Kelly was saying. Sometimes people think it's boring to eat healthy. No, make your plate colorful, because the colors on your plate, it means that you're gonna be colorful and fruitful. So I thank you for bringing up that point. And again, just really acknowledging Mental Health Awareness Month and all of the challenges in our world, the calamities in our world, from mass shootings to, hate crimes, to kids going to school and not making it home, to Black people going to the supermarket and not making it home. This is real. And so when we talk about health and wellness and mental and physical disparities, we're talking about all of these things that are going on and how we can prevent this harm on our bodies. And so, Dora, I want you to just, if you can share a little bit about how you feel about this question, and I can repeat it again, because I know we said a lot, but what are some of the current challenges of addressing disparities that you see in your community?
Thank you for the question again. My current challenge right now is that I haven't had that barbecue, Kelly. But no, but in a serious note, I'm so glad that we talked about, and I think really, again, bird's eye view looking at this is really the psychological perspective from the Black bodies, how society views and values Black bodies, right? And it is also us It is the self-hatred that we have adopted and the trauma that has been passed on from generation to generation, where we don't think we have the power, the right, and the necessity to advocate for our own and the tools to advocate. I think Kelly mentioned about Kelly and Pilar, I believe you both mentioned about the language, the vernacular, knowing the jargon. Melody, you mentioned about the questionnaire and competent conversations. All of us who are in this space, even our nonprofit does competent conversations with providers because it is so crucial. Whether you're in a rural space or you're within the city, understanding that it is okay to ask questions, that it is okay to say, I don't know the research, but I need you to teach me, and I need us to look further. I need a second opinion. I need someone to look at me and say, there are clinical trials that are focused on the symptoms you're experiencing. Are you interested in that? And that being an option of care. I need you to look past me and know to not assume that I may not have the competency or the same medical educational background, but that I can continue a conversation about my care and make an informed decision based on what you tell me. So there's so many levels. And I think the biggest thing addressing this is really going to be looking at the psychological perspective, addressing the psychological and the perspective of Black bodies in this space, in the healthcare continuum spectrum, whatever you want to label it, and bring people to that point where they recognize their own individual power, privilege, and positionality, whether you're a provider or not, and how you can impact. My son is agreeing with me. How you can impact someone's care, specifically Black bodies, because when we look at Western medicine, it was built off of the Black body, right? Studies that we were not agreed to or were able to participate on. That's going further back than Tuskegee. And if you don't know,
read Medical Apartheid.
Exactly. If you don't know, there's literature on it, and you can find it. So it's so important to address these things and address it within our own home. I mean, I think everyone has heard like, oh, you're going to the doctor? Make sure you dress right. Of course, you feel good when you look good, right? But there's a level to that. There's something deeper to that. And Pilar, I'm sure with you and your psychology background, you can share on that. But that is it's important to understand that if I'm not feeling good and I'm coming crazy, or not crazy, but looking not my best to the provider, I still should get 100% quality care. And so for me, that's the biggest thing. And we at Beyond Patient Health Equity, we try to address these things in the younger generation, in the events and that we curate and the conversations we have. We really focus on that middle school age where you're still learning your identity, still don't understand the relationship that you can have with providers, specialists, right? I didn't know much about specialists growing up because I wasn't unhealthy, but nonetheless, I still should have known about them, right? And so creating those relationships, creating that normalcy is important so that children, the next generation, can make informed decisions, can have that autonomy when they're in these spaces, and can carry out a conversation with confidence and say, you know what, I don't feel like you are treating me in the way that I deserve. And so I'm gonna remove myself from this space, because the truth is, being a person of color, specifically African American, there's research that supports responding to racism has direct impact on your cardiovascular health. Just a response. So, there's so much out there that we can do to change our trajectory, starting with the perspective and really focusing on the next generation.
I wanted to just add something to Dora. You brought up a great point when you talked about trials. And at Coachy, we're actually changing the language, because trials is a very alarming and harmful word to a community that faces so much injustice. And we've been talking about it because our community doesn't always recognize that research is an opportunity for us as opposed to an exploitation. which we felt from historical medical apartheid, Henrietta Lacks, Tuskegee. What we do know, that word feels like oppressive in so many families. They don't feel like it's an opportunity. But as to what you were saying, you're talking to these young kids. We talk to college students just because we believe it's multifactorial. They can change the mindsets of their parents and they can impact their nieces, nephews, children. But teaching them about informed consent, IRB, that they can opt out so that they understand that if there's something that's not working, research is an opportunity. It's not to your detriment, but it's to get you elevated possibly, because this drug or this information may change what the outcome is. So we have to, as a community, we have to undo some of those harms. And it's important that we do educate the children and the young adults as best we can so that the inequities from the past don't show up again and again in the future.
Thank you both. Thank you both for that. And the psychological trauma that, Dora, you were alluding to, this psychological trauma that does date back beyond Tuskegee, and these trials that where the mistrust of the system, the medical system, has generated, because and over time it's perpetuated because we're telling ourselves this narrative that implements fear. It elicits a lot of fear and it changes the way that we even approach our bodies. And so as we're thinking about this, and I know it's almost time to wrap up, so we're going to, make sure we do that. But I thought about James Baldwin's quote: "To be Black and conscious in America is to be in a constant state of rage." And I think that there's a lot of rage and consciousness going on hand in hand when it comes to health equity and what's going on. But we don't have to always be in a rage. We can actually use that consciousness, like Dora was saying, and Melody was saying, and Kelly was saying, to educate ourselves so we can be elevated and we can promote and propel health equity and advance as a community. And so as we wrap up today, I'm so thankful for you all of your voices. I want to just hear from everyone. We'll kind of do like a rapid fire where you say health equity is, and then blank, and then where can people find you so we don't have to stop this rich dialogue and we can give the resources that we've been talking about. So I will start with Dora. Health equity is?
Health equity is me. It's the life that I'm living. It is what I'm doing for my children, my daughter, my son, for my husband, for my family, not just here in America, but also back home in Africa. It's the changes that I'm trying to make for the next generation and for myself now.
Kelly?
Good question. Health equity is, from my perspective, just taking responsibility for self, understanding that is the health journey, and really having love of self again to create an environment of self-care, so that you can really have a structured dialogue with whoever your healthcare professional is, without them sort of telling you what it is, but you sort of coming to the table together with a plan of attack, just as Melody sort of specified.
Melody?
Health equity is non-negotiable. It's just non-negotiable. I'm going to get what I need. If you're in my community, you're going to get what you need, and we are going to win because it's no longer a space that we can afford to miss.
Health equity is us. Health equity is the people. Health equity is our families, our friends, our spouses, our partners, our doctors. Health equity is the system that continues to break us down, but we can lift it back up by knowing what health equity is, by telling each other and educating and providing resources and sharing the wealth, because health is wealth. And so I thank you all today for such a phenomenal conversation and a rich dialogue. And if you can put your information in the chat, that would be great. And I'm going to take some questions from some of the audience that I have right now, and I'll direct them. If the audience wants to say who they're directed to, go ahead. If not, I'll ask it generally so we can get this other dialogue going. Okay, So the first question that I have, are there a list of Black providers? Is there a list of Black providers in Massachusetts?
So I can share, since I am in Massachusetts. I am not familiar at this time, but I'm sure more than one of the participants can share to that. What I do know is that there are different applications and websites that do list providers that are also Black owned, like InnoPsych, which is a great list of providers that are focused on psychology. And it's not just to Massachusetts, but it extends to different states. So I'd strongly suggest checking out that website if you're looking for a mental health provider, given that we're all trying to address our mental health and stay afloat with that.
I don't know of a list in Massachusetts, but I do know that if you are looking for a Black gastroenterologist or hepatologist, you can always go to blackandgastro.org, I believe. It's the Association of Black Gastroenterologists and Hepatologists, ABGH. So that is a space that I know that might be able to support you in locating a gastro if you're looking for one in that area.
Awesome, thank you. And yes, InnoPsych, absolutely. Dr. Charmaine Jackman, she's the founder and CEO of InnoPsych. So that's psychology. Again, psychology and physical health go hand in hand. And then Melody has put one as well that you all can follow, and also blackdoctors.org. That's, national, so you can find a doctor in your nearest location. There's also Pure Spark, which is for psychology as well. And again, we want to make sure that health is a holistic space. And so if you can find one Black psychologist, you could go find another Black or brown holistic provider, another Black. We want to make sure that we diversify the space so that you have something and someone for everyone. The next question, okay, it's a similar question. So let's see if there are any more. Don't be shy. Okay. Yeah, so I think that's it. I think that is it. And then people are still processing the rich dialogue that we were able to have today. And I'd be remiss if I did not thank Anna Foster, a Maven's World Conference, for this phenomenal event. This is the 10th one. So just making sure, 10th year anniversary. So making sure that we celebrate, and a big part of celebration in our Black communities is liberation, liberating our bodies, liberating our minds, and liberating our spirits radically, knowing that health is wealth and that we can too survive and thrive. It's time to take more control over our bodies, because we have more control and we have a say. And so I thank each and every one of our speakers. Make sure you follow all of us. And we're plugging each other in our bios and all that stuff. You have the information, but make sure you follow up and be well.
Thank you, everyone. Thank you, Anna.
Thank you, everyone, for joining us for part 3 of the Future of Women of Color and today's session, Advancing Health Equity for Women of Color. This has been a thought-provoking and impactful discussion, and I hope you are inspired. If you have not done so already, be sure to connect with us via our website and our social media handles at A Maven's World. Also, be sure to follow the social media and the work of our esteemed panelists. Thank you to our sponsors, State Street Bank, Wellington Management, Mass General Brigham, Eastern Bank, and the Greater Boston Chamber of Commerce. Thank you to our partners, Boston Impact Initiative, National Society of Black Engineers, National Black MBA Association Boston Chapter, Startup Life by Andy Lyons, Amplify Latinx, and The Dinner Group. Please take great care of yourselves and each other, and please stay connected.